Hi, in part 3 of this series on abnormal LFTs, we're going to talk a little bit more about raised ALP. So, raised ALP that's higher than ALT can suggest a cholestatic obstructive pattern of LFTs. So, it suggests there's something going on with the biliary system. So, a very common issue with that is gallstones. Now, gallstones can be just present in the gallbladder and it doesn't really cause any issues. So it can be found just incidentally, for example, in doing an ultrasound scan or a CT scan. Now, sometimes these gallstones can cause issues such as pain, and we can sometimes define that as biliary colic. So sort of moving up and down. As you eat a fatty meal, it stimulates the gallbladder to contract, and they can temporarily get stuck or cause inflammation. So you get that pain for a number of hours, but it usually does resolve, and that's biliary colic, and the pain comes back in future. So usually in these kind of cases, the ALP is normal because the gallbladder is not, sort of inflamed enough or causing enough issues there. So if the gallstone gets stuck, for example, at the neck of the gallbladder, it can start to add pressure to the gallbladder, and it can expand, cause inflammation. That we might term acute cholecystitis. And usually these patients have a raised ALP, they have right of quadrant pain, which is constant, which is lasting quite a while. They can have signs of infection of the gallbladder, so fever, high white cell count. So these are the kind of features of acute cholecystitis. Now, ultimately you want to get a sort of an ultrasound scan done to check for all of this. So usually when you get this abnormal LFT, ultrasound is probably the best thing to go for next. You might see the gallstone, you might see inflamed gallbladder. If that's the case, then ultimately they may be offered a cholecystectomy, which is removal of the gallbladder after some antibiotics and the usual resuscitation they may get. Now, one thing to watch out for in managing gallstones, cholecystitis, is there anything else going on? So you don't want to take out the gallbladder and actually they also have some other issue elsewhere in the biliary tree. So we need to just ensure that there's no signs of a ductal stone, or if this is the common bile duct, I don't know if you can see that quite easily. So you need to make sure there's no CBD stone. Now, CBD stone, because it's in different area of the biliary tree, it can give some different signs and symptoms. So you can get, if the common bile duct is obstructed, then you might also have raised bilirubin, because bilirubin is being kind of obstructed to be released. So that will increase in the blood test. You might see on the ultrasound scan some signs of what is called duct dilation. So something that you look for in the ultrasound scan when it's done. If this is the case, then before doing any kind of cholecystectomy, you will likely need to go ahead and do something called an MRCP, which is a sort of MRI scan of the biliary tree. So this visualizes the common bile duct and the biliary tree in more detail, because the ultrasound scan, it's not as good as looking at the CBD area because of the bowel gases and things that come on the way. So the MRCP is more appropriate to do. If the MRCP found something in the common bile duct, then you'd be looking at thinking about doing ERCP, which is an endoscopy into the bowel ducts to see if they can retrieve that stone or treat it. They can also put a stent in, for example. So there's different things they can do with the ERCP. So this is a sort of an overview of the management of sort of gallstones. But this is something that can typically raise the ALP a lot higher than ALT. So just gonna make a bit of space. So the other issues that might cause a high ALP, a high bilirubin, let's say they had no pain, so they had sort of no pain but raised bilirubin, ALP, you'll still be worried about some sort of obstructive jaundice. So what are the other things that can cause an obstructive jaundice? So they can typically have yellowing of the eyes, of the skin that other people may notice for them, or they can have what is paler stool and darker urine. The reason is because the bilirubin cannot escape into the bowels, so the stool is paler, but is kind of getting reabsorbed and passed out in the urine instead, so you get darker urine. Now, if there's a sort of let's say a cancer at the head of the pancreas, then it can obstruct the common bile duct and cause an obstructive jaundice. So that's something you would definitely want to look for if you have a abnormal bilirubin ALP, but there's no real pain, or you're not suspecting a gallstone or ductstone issue. So that's one reason. There is something called Courvoisier's law. So Courvoisier's law is sort of a, when you're doing an examination and you can palpate sort of a mass, if you can palpate the gallbladder and there's jaundice, then it's unlikely to be gallstones. And the reason for that is, usually if it's a chronic gallstone issue, you shouldn't be able to palpate the gallbladder because of the fibrosis that occurs. So Courvoisier's law sort of points towards the pancreatic cancer. Now, we talked about the pancreatic cancer or CBD stone causing obstructive jaundice, but there is another condition called, I don't know if I'm going to spell this 100% correctly, but Mersey's syndrome. So this is quite interesting in a way, because let's say you have the gallbladder and you have the sort of what's called a Hartmann's pouch. Now, if the gallbladder gets jammed in the Hartmann's pouch, the common bile duct is sort of running very much next to it. So the stone that is impacting the gallbladder in this particular area can sort of compress the common bile duct. So it has the same or similar effect to a common bile duct stone, but it's just being compressed sort of externally. So that can cause obstructive jaundice, Mersey's syndrome, but it's still caused by an issue within the gallbladder itself. So that's sort of a sort of general overview of ALP, bilirubin. But I think in this case is if they're in pain, then you pretty much have to look at admitting them, getting the ultrasound done, MRCP, to look for what is causing the sort of pain with the abnormal LFTs. You can get acalculous cholecystitis, so cholecystitis without stone, as the name suggests. Now, there are different causes for that, but for example, shock or something like that, that can cause an issue with the blood supply of the gallbladder. So there are slightly different variations on this, but common things being commoner, this is sort of what the first line of investigation would be if you noticed a obstructive pattern on the LFTs. Alright, I think that is it for liver function test for now. Then we'll probably revisit it at some point, I'm sure, but I hope this was sort of useful in a way to think about looking at liver function tests and sort of what the different causes for it. Alright, thank you very much.